Start.
Today, hello.
Yes, we can hear you.
Okay, today I am starting a presentation about preparation of lesson plan in yoga, preparation of lesson plan for individual and group, presentation of lessons in yogic practices, assessment of yoga class, measurement, examination reforms, program evaluation, and assessment of yoga centers and institutes. The class is starting with a prayer. Om Sahanavavadu Sahanau Bhunaktu Sakavidyam Karavavahai Tejasvinavaditamastu Mavidyushavahai. Om Shanti Shanti Shanti. The classroom arrangements for yoga. It will be an open space concept in a main room. The classroom will be in calm and quiet place. That will be useful for taking yoga classes. That will be pollution free. Environment will be free from sound, air pollution, sound pollution, etc. It's an illumination. Highly illuminated will be very useful for yoga class. Sufficient ventilation. Air circulation will be more. It will be useful for our the pranayama practice, etc. Color scheme. The color scheme is for, it will be not a dark color like that.
Slide number 3.
Acoustics, ceiling height. Standard size of yoga class usually 20 square feet. Guidelines. Okay. Guidelines for yoga class. In general, yoga practice is commended in morning or early evening. The morning will be the stomach, empty stomach will be do the practices. Otherwise, after food, up to taking food after 2 hours, we can take classes. The students will be arrive early. The class will be starting with a short prayer and ending also with a prayer.
The guidelines for this, you talk as per the slides. Shine, you talk as don't talk your words. Talk as per the slides.
Okay. Plan to stay for whole class. If somebody is late coming or early going, that is not suitable for the class. It will be discipline. Leave your shoes outside the door. Leave your cell phone outside. Practitioner needed 6 into 3 feet place because the movement of the body, let's say 6 into 3 is enough. Bring water, towel, and your own yoga mat. It is a yoga mat will be cotton or bad conductor. The energy will be does not going through the earth without mat. That's why we are using cotton or bad conductors yoga mat. Avoid perfume or scented lotion. Wear clothing appropriate for class. Appropriate clothing is suitable for the class. Loose clothes are very good for this. Let the instructor know about any physical issues, and if somebody has some health issues or it will be informed to the instructor, otherwise it will be difficult for the practice. So next. Preparation of lesson plan in yoga. Prepare lesson plan for individual and group. The participants of yoga group grouped under the following headings: beginners group, experienced school children, special attention group. Beginners group, persons of all ages, males, females, young and old, special individual who are making the first acquaintance with they need general background of yoga discipline. The beginners, we have to tell about what is the yoga and the purpose of the yoga, everything. That's a beginners group. Experienced group, those who have some experience in yoga, they coming under experienced group. They will be asanas and everything will be very easy for the school children. Group of ranging from 6 to 16 years, they need exposure to field of yoga based on their immediate needs of their age and temperament. School children are coming for the yoga practice for increasing their talent or concentration or like that. In their study, it will be very useful. Special attention group, the slow growth children. These individuals can vary on the basis of gender, on the basis of individual problems, health, handicapped children. All these are coming under this group. All these individuals need special attention. This is one of the teaching method in a classroom. The yoga class starting with the starting prayer. Then we should tell which asana is we are taking, the name of the asana, then meaning of that asana. Here I am giving an example of Akrasana. It is twist posture. Type is sitting. Justification is upper portion of the body is twisted completely. Category is a cultural. Counts 8 count. Complementary. Akrasana complementary self. Step 2. Demonstration. To tell about the how to do the asana by demonstration. It's a silent demonstration or demonstration with the counts. Demonstration with the counts, breathing and explanation. Then the sthiti of this asana, you have to tell the dandasana. Relax in dandasana. Step 3. Benefits and the limitations of these asanas. It stimulates the pancreas, useful for diabetics, relieves constipation, aids digestion. Then they can understand what are the benefits and the limitations of each asana or pranayama, anything. Then help to reduce the fat around the waist region. Lateral twist gives flexibility to spine and the nerves. Removes backache. Helpful in kidney problems. Expel gas from the abdomen. Strengthen the spleen. People who have undergone recent abdominal surgery avoid this posture. Step 4. Individual practice. In yoga class, normally the teacher should see the students how they are sitting. You can place them in one side or arrangements in two sides. Teacher should see everybody. Then we give individual practice for the students. Then afterwards, you have to group practice. All class practice according to the instruction of the teacher. Step 5. Practice in groups. The class is divided into two groups, A and B. Group A will practice and B will watch. If there is any correction, they will correct them. Next, B will practice and group A will correct. It is necessary. Step 6. Key points. Some misalignments like that, anything is in the asana, you have to discuss. Key points. Back erect, try not to bend the stretched leg. Step 7. Whole group practice keeping the subtle points in the mind. Whole class will practice according to the instruction of the teacher. Then step 8, questions and answers, and the class will end it with a closing prayer. This is the procedure of a yoga class. Next. Preparation of lesson plan yoga. Preparation of lesson plan for student group. Students. They can be a student 8 to 10 standard. They are flexible and they can perform asana. Anything. Students' body will be very flexible. They can do any asanas. They will have impact on their study skill and talent. That's why they are coming for these practices. We can give them stretching exercises, pranadharana, etc. at starting time. They don't know how to start this yoga practice. Then you have to give them some small stretching exercises and pranadharana, etc. Aim of the practice: develop healthy habit and lifestyle in children, to develop human values in children, to develop physical, emotional, and mental health of yogic activities. Figure out the amount of time you will teaching and break it down into segments. You can divide the class into small time segments, and each time segment we have to allot each of them. Analyze. determine the needs of the students. Why they are coming for this yoga practice? You have to analyze the students. Engage, plan your resources and materials. Resources and materials needed for the yoga class. You have to take some teaching aids. Somebody have difficult postures. You have to give them yoga block, some yoga belt, like that. Some teaching aids, audio visual aids. So we can apply. Engage students. Instruct and present information. Allow time for student practice. But each student can practice, and you have to allow a time slot for students. Ending the lesson and evaluate the lesson. Ending the lesson and evaluate how they have done this postures. What are the difficulties they have met in the practices? Okay. Preparation of general lesson plan in yoga. General category. General category is stress level controlling. In general, the corporates, IT sector, or financial sector, we are putting them into this general category. In which the stress in their job is related to more stress during the course of their day-to-day work. This stress is lead them to vyadi of various types of stress levels. Give them practice of reducing the stress level. Call them, somebody have no time to attend yoga practices, then we have arranged them at the lunch time or any other break time. We have to conduct practices, and they can take the confidence of the management or department and ensure that their daily work, their stress level will increasing, their job also related to the stress level. They can, in a good manner, they can conduct their job. Various practices for this people we have proposed. Sushma Vyayama, Parana Dharana in meditation, Kapalabhati. Kapalabhati also we are taking, count is very less. You have 20 strokes, like that you have to at the starting time. Vibhagiya Pranayama, asanas, various types depending upon age. Some age group is more age group cannot do asanas like that. Their body is not flexible, and give not normal asanas or any pranayama, pranadharana like that. In the relaxation, shavasana or chaitanyasana in the last. That will give more relaxation to the body. Keep it in 3 days in a week. They cannot daily, they cannot conduct, they can conduct in 3 days in a week. See the results in 3 months, their performance in work. It will affect their performance in the job, and their behavior pattern also improve. In patient category, the above diseases occur due to various factors. More people have now lifestyle diseases. We can control them through yoga. This patient category, they are coming for their problems. Diabetes, it can be hereditary, asthmatic, obesity can also due to lifestyle and environmental factors. Categories them, make them in sitting group of yoga class depending upon health conditions of the patients. Following practice proposed because Sushma Vyayama, Stula Vyayam, joint loosening exercises are given first time to the patients. Kriya like Kapalabhati, Anilom Vilom, Vibhagya Pranayama, all Ashtakumbhaka Pranayama. Relaxation and deep relaxation with awareness.
Next slide.
Okay. Guidelines for the practice of asanas. There are some guidelines. Generally, the asanas are practiced in the sequence of standing, sitting. 4 types we are categorized here: standing, sitting, prone lying, and supine lying position. For example, standing as an Artha Chakrasana, Trigonasana like sitting, Vajrasana, Sasangasana, Ushtrasana, like a prone posture, Salabhasana, Bhujangasana like that, supine. the Sarvangasana, Chakrasana, etc. Generally, the asanas practice sequence, though there is other version which follows different sequence. Asanas must not be practiced by force under any urgency. We should not practice them by the force. We cannot, somebody cannot perfect in some asanas. They cannot do in perfect. Then should not force them to do like that only. Don't one thing it is not compare with others. If somebody is doing better, somebody is not doing better. Don't compare with others. It is not a competition. Jerks should be avoided in time of asanas. Stiram sugam asanas. That's a steady and comfortable posture. Asana should be performed with body and breath awareness. Otherwise, it will going to exercise. Exercise and asana is different. In asanas, there is an awareness in breath, but in exercise, not doing like that. Coordination between breath and movement of body parts. As general rule, inhale by some common rule in this asanas. When inhale, raising any part of the body, exhale when bending down. That is some of the rule. The practitioner has to follow instructions sincerely with optimal attention.
Next slide.
Guidelines for practice of kriyas. Kriyas should be done with an empty stomach. Otherwise, it is no effect in kriyas. Kriyas should practice. Therefore, it should be done preferably in the morning. Only morning we are selecting for doing kriyas. Kriyas should be performed under supervision of an expert. It should not be done alone. Some complications or anything is happening, it is difficult. So it is performed under supervision of an expert only. Each kriya has specific process. Each should be strictly adhered to. Different things like water, salt, air manipulation are used for each kriya. Kapalabhati. Kapalabhati is a frontal brain cleansing. Kapalabhati considered a kriya which cleanses the um, uh, frontal brain. The sinusitis problem, anything it is useful. Kapala means skull and Padi means shine. Kapalapati helps to improve functions of the organs located in the skull. Any problems related to skull, the Kapalapati is very useful. A stroke of Kapalapati begin with 20 strokes at a time. This is one round. One can practice 1 to 3 rounds in a practical session. Gradually increase the strokes. After practicing, only increase the strokes. In starting time, you should not do more counts of strokes. Remember the following do's and don'ts. Inhalation should be passive and short, while exhalation should be forceful. Kapalabhati should be practiced after asana, but before meditation. Do not move the chest or shoulders during exhalation time. Do not contract or distort face. The benefits of Kapalabhati, it stimulates nerves in the abdominal region. It tones up abdominal muscles and improves digestion. Kapalabhati expels more carbon dioxide and other waste gases from the lungs than normal breathing. It improves heart and lungs capacity, therefore good for asthma. It improves blood circulation. It energizes the body. It removes lethargy. In yogic practice, Kapalabhati and Agnisara Kriya. Limitations of Kapalabhati. Those suffering from cardiovascular problems should avoid Kapalabhati. High blood pressure, hernia, vertigo, gastric ulcer complaint. It should not do Kapalabhati. Agnisara, it's a Kriya. The meaning of Agnisara is to increase the gastric fire. Agnisara is very useful for any gastrointestinal problems. This Kriya regulates essence of fire, which is supposed to be located in the navel region. This practice regulates functioning of abdominal organs. Any problems relating to abdominal organs that we can do Agnisara Kriya. Do's and don'ts in Agnisara Kriya. It is advisable to practice. It should be do in empty stomach only. Morning we can do this Kriya at empty stomach. Do practice for 2 or 3 times. Avoid slightest inhalator effort. Do not practice it after meals. It strengthens the abdominal muscles and nerves. It improves gastric fire and stimulates appetite. It alleviates constipation and sluggishness of liver. It alleviates dullness and depression. Limitations. Persons suffering from high blood pressure, heart disease, peptic ulcer, chronic diarrhea should not perform this kriya. Asanas in specific lesson in asana. Final position should be attained slowly, step by step in asana. It should be maintained with closed eyes for developing an inward awareness within the body. Regular practice is essential. Body starts listening to your command only after regular and diligent training for sufficient period of time. If regularity is required in this asanas practice, one should resume the practice within a minimum time. Initial phase asanas involve deconditioning and reconditioning processes. Guidelines of dhyana.
Yeah, do's and don'ts.
Do's and don'ts. Inhale the air slowly without bulging the abdomen. Keep the ratio 1:1. Inhale 1:1 and 1:2 between the inhalation and exhalation. Avoid producing sound from the nose. Do not press hard on the nostril. It will, and we put more pressure in the breathing is very difficult. That is, should not press, not hard. Retaining Kumbhaga in the beginning, personality development through yoga benefits. It calms down the mind. Guidelines, guidelines of the practice of meditation. Practice of asana pranayama, if performed before meditation, will help in developing ability to sit it in one position for considerable period of time. Asana and pranayama will be performed before meditation. At the last only we are practiced to meditation. Select a peaceful and calm quiet place for practice meditation. Allow your eyes to get closed gently to enter into inner awareness. For inner awareness, we close our eyes and concentrate on inner awareness only. A meditative practice involves many thoughts, memories, and emotions. In practicing the meditation, more the thoughts are coming. Emotions may surface on the mind. Remain non-reactive to them. Should not react to them. As you continue with this process for some time, you may feel abstract and non-specific awareness of the whole body. Now continue with the whole body awareness. In the beginning, it is generally difficult to observe the practice. In meditation, in the Sri Sri school, they are telling one special rule for that. They are telling, I am nothing, I want nothing, I do nothing. Then that thing we have to take into our mind, it will be very useful for meditation. Mhm. The next evaluation scheme. Practice scripting, especially if you are teaching, use the extra copy of the lesson plan to practice at home. That will be helpful for the students or participants. They can practice at home also. This helps to gain confidence and successful classroom instruction. Be walking through the lesson plan. You will find the areas might be need taking. After we have to complete the lesson in the classroom, evaluate how it went. how they absorbed what thing we have uh, taught in the classroom, how they absorbed and how they practicing, what are the output of the result that we can to evaluate what parts worked and which one need adjusting. Give yourself wiggle room in each the lesson plan to make the term evaluation is closely related to measurement. In this evaluation, some measurement also given. Some patients are coming and how do they evaluate the diabetic patient there the pathological readings we have to calculate and how it is if it is decreased reading then the diabetic is reduced like that. In some respect includes including informal and intuitive judgment of pupils progress. Evaluation discusses something in terms of selected attributes and judging the degree of acceptability or suitability in which it's described. Evaluation is a systematic process determining what extent instructional objectives achieved. It is a systematic process. Evaluation in application. It involves the use of information collected by the process of measurement. Measurement. It is a science of collecting and ordering information. Measurement, assessment, and evaluation concept, principles and application. Measurement. It is the science of collecting and ordering information about objects studied. Here only the measurement is the patient case it is a pathological reading. A student's case it is the marks they are scored in their exam. And like that. Evaluation it involves use of information collected by the process of measurement. A pathological reading in the case of patient it means a subjective judgment. Examination reforms and designing formative reforms and evaluation. Educators are using summative assessment. Summative assessments in various forms since invention of schools and teaching. Summative assessments have in the recent decades become components of large yogic school improvement efforts. Summative assessments means the total output. Formative means in the we are teaching time what they are not in the normal or how they are studying conduct. That is only formative. Summative assessments can help teachers determine whether participants are making adequate progress or meeting expected learning standards. The result is used to inform modification to instructional techniques. We can modify the classroom. How some students want to some modifications. We can modify the classroom from their opinion. The lesson designs also we can modify. Next. Program evaluation of yoga class workshop and camps. Verify the qualifications of the instruction and yoga teacher faculty. Senior yoga teacher. Each faculty member apprentice study with etc. Senior teacher is reputable because some senior reputable teachers are taking classes. The students, more students will go there. Check the reviews, some feedback. We are asking the students which yoga class is how they are conducting like that. Then some the reviews or feedback is available from each yoga centers. We can evaluate on the basis also. Check the value of the yoga institution certification. It is a certification recognized throughout the world or just within a particular city of region. Some yoga centers are alliance with world institutions or some in our India it is a yoga certification board is the approved authority like that. Compare each yoga teacher training curriculum. Somebody conducting 200-hour teacher training somewhere we can get a 500-hour like that. Classes with the teachers who have previously gone through the program. Do you like that? Some teachers style of classes is different from different yoga centers. Pay attention to alignment. Do they provide options? Next, assessment. One of the primary measurement tools is assessment. The assessment should be carefully prepared and administered to ensure its reliability and validity. Assessment must provide consistent results. It must measure what it claims to measure. As per the following criteria, professional assessment board can give overall grade to yoga centers. Because some professional board, like the YCB, they can give some grade to these yoga centers or teaching centers. Teaching to the level of experience and physical capacity of students. Offering modified practice. Yeah, some students can flexible and do more practice. Some need more practice, some need not much practices. We have to analyze them. Offering modified practice and individual students and explaining areas of caution of relevant to individual medical condition. We have to record the medical conditions of the students or participants in a record. That will be very useful to teach the participants. Recognizing that we have to do not have the knowledge of to safely teach a student. You should not do so. If you teach a group of students with specific needs, for instance, pregnancy classes, children's classes, classes of special needs of students, you must have training of experience to do so. You have some special classes. You have prenatal and postnatal yoga, you have children's kids yoga teachers training. That is the different thing we have to learn and teach the special categories. Next. Assessment of yoga centers and institutes, risk analysis, risk assessment. Your duty to care extends to seeking information need to teach students in an informed way. This includes seeking of information about the level of students' experience, physical capacity and health. Participants' physical capacity and health different to different divisions. We have to consider them and to categorize in different group and give them teaching. It also includes observing students as you teach and adjusting your teaching according to the observation. Information enabling you to adjust the teaching to meet the needs of individual students. Yeah, why they are coming individual students, the needs we have to consider. Okay, we have to improve their capacity of concentration or talent in learning skills, etc. Health questionnaires should be included, starting that if students are receiving medical treatment or suffer from serious illness, injury, and their state of health, you have to consider. Always keep a register of attending your class. Registers serve several purposes. And put in the register their name, what any medical conditions, or why they are coming, what are the needs. We have to put in the register and keep it there. One of which it is record witness of the circumstances in an incident or some injuries happening in the practicing time. We can observe that thing. Scheme of work for terms of teaching together with the class plans showing the practices taught. Modifications also we can like because some problems are attaining practices or something we can to modify the practice. If changes are made during teaching, this should be noted. What changes are we are taking the asanas the practices we have to note. Okay, next. Two kinds of assessment. It is formative assessment and summative assessment also there. Formative assessment is a less formal check-ins what you during the course to see if people are picking up what you are throwing down to go along. Formative evaluation is due during the teaching learning process to monitor the learning. The formative evaluation is the monitoring of the learning process. The formative and development in nature. The aim of this evaluation is to improve students, participants, learning and teachers teaching. It is an online process. Formative assessment teaching time, we have to evaluate the students' practice. Teachers using some tests to know what extent the instructional objective has been achieved. Formative assessment practices of students and teachers using evidence of learning to adapt teaching and learning to meet the immediate learning needs. From this, we can assess the students. Yeah, in a typical yoga class, in a typical yoga class from start to finish, students are practicing. Teacher tells students to move to follow, and students practice those moves. Teacher walks around the class and observe what they are doing, how they are doing, any misalignments or anything is happening. To correct it, teacher will make comments about how to improve the poses. If somebody has any difficult or posture variations, to take them to improve the postures. Teacher makes general comments and everyone can use. If somebody has difficulty, you have to help with the teaching aids, audio visual aids, like that. These suggestions, corrections made in a real time. Immediate impact on practice makes to posture better. The formative assessment is very useful for to make the posture better. While you are in plank pose, push your or weight through the heels, tighten your stomach. Formative summative assessment at the end of the course, like particulars, the exam or total result. Summative assessment means the total result. There's a difference between formative and summative assessment. Formative assessment is the online teaching time we have to improve. Summative is the total result, the output. In teaching, we have to give grade or anything. Summative is the given conclusion of a specific instructional period. Therefore, the generally evaluated rather than diagnostic. Participants get patients case we have to after diagnostic, okay, their yeah, sugar level is very less or like that. That is the total output for a patient case. Okay? Students case it is they have scored more marks in their exams, like that. That is summative assessment. The more appropriate used to determine learning progress and achievement. Summative evaluation is terminal in nature. It's a purpose to evaluate students' achievement or participants' benefits. Standardized tests are used for the purpose. In patient case, we get result from their pathological readings. In pathological readings, we can analyze what is the improvement or why they are coming here and what benefit for them. It helps a teacher to know the effectiveness of instructional procedure. It will help the teacher to know total effectiveness will get the teacher. A large number of skills can be tested in the evaluation. It is not a regular and a continuous process. The formative assessment is a continuous process and regular. It is not a continuous. It is a total output. Final total output is the summative assessment. It answers to questions and degree to which students have mastered the course content. Next. Next is program evaluation. We have to evaluate yoga centers using evaluation form. The workshop evaluation form. Please rate the following questions and we have to give some grades to the questions. It is 1 means strongly disagree, 2 means disagree, 3 is neutral, 4 is agree, 5 is strongly agree. You have to give this application form. Then the presenter was organized. Then they will give 1 or 2 like that. The presenter will be on time and use the time well. The presenter using the time and use the well. The time is it's very useful. They are using. The presenter was extremely clear. Yeah, what they are presenting, it will be extremely clear to the participants. That is good evaluation. The presenter was well prepared. He is well prepared. Presenter how responsive to questions, how he can answer the questions or any question the students or participants are asking to the presenter in a yoga center. We can analyze with this by putting the grades 1, 2, 3, etc. We have given here. The presenter held attention to the audience. Here, presenter sometimes without attention they are taking practices. There some students are doing mistakes also. He's not attending. That is also difficult. In this evaluation form, that also we have given. The presenter was knowledgeable. He has any knowledge or no knowledge. That is also the feedback form. It is introduced. The presenter participant interaction was sufficient. Your presenter is interact with the participants. That was this presentation was well tailored to audience. Next. Workshop. What did you find most helpful about the workshop topic? List any suggestions to improve the workshop. You have to collecting the suggestions from the participants or students to improve the workshop or teaching methods and put it to improve the class. Please suggest a topic for a new workshop. If somebody has a new workshop or anything like that, we have to suggest a topic from the students or participants. From this evaluation form, we can evaluate the workshops or yoga centers from the feedback collecting from them. Okay, thank you. Ending with the prayer.
1 minute.
Sarve bhavantu sughinah, sarve santu niramaya, sarve bhadrani pashyantu, ma